So I think in the current state right now, as far as vaginal birth after cesarean, is that there are many concerns that women have. One is that they've always wanted to have a natural birth, and the fact that they've had a cesarean, their options are now challenged or limited to some degree. And there are certain providers who will go ahead and allow a vaginal birth after C-section. Others will sort of say no. So I think a lot of people these days want options, especially because the first time may have not been what they expected. There may have been a pregnancy issue that is non-recurring, that happened at that time where they needed to be delivered by a C-section, and now they want more options. So for me, in terms of counseling my patients and for what we have here at Griffin Hospital, is that we do offer vaginal birth after cesarean section. It is an option where we need to discuss the various ramifications that can happen to both the mother and the fetus during the labor process. But then again, the goal would be having the woman have a easier recovery time. And the best part is also the fact that I think that the bonding between the mother and the child will be much improved, especially if they're not in pain and they're not suffering the way they did before with the previous cesarean section. Such that also the benefits of a vaginal birth after cesarean section is that the woman can successfully vaginally birth even with a higher percentage the next time. So it is one thing where right now in the United States we have a 30 to 35% section rate. Those women of the 4 million roughly who deliver each year want an option, and certain locations won't offer it due to safety reasons, which I completely understand. But again, in the hands of a skilled team here, which we have at Griffin Hospital, I believe that we can offer these services and again, make modifications as we need for a very good and healthy outcome. The good news is that for vaginal delivery after cesarean section, a majority of women can undergo this particular type of birth and be safe. So we're looking at numbers of anywhere between 60 to 80%. We are looking at, in terms of Griffin Hospital, a very excellent team of nurses, physicians, and anesthesiologists who can make the experience for that particular person much more robust and enjoyable, and again, safe.